My name is Dr. Roberta Luskin-Hawk, Department Chairperson of Medicine for St. Joseph Hospital, a Resurrection Healthcare hospital. I'm here today to share information with you about the H1N1 Influenza A virus, formerly referred to as swine flu. First and foremost, the Resurrection Healthcare family wants you to know that the safety and well-being of you and your family are our highest priority. Our team of medical, emergency, and infectious disease experts is working around the clock with national, local, and city public health agencies, as well as community leaders and many others, to protect your health. We also have taken all the necessary precautions to proactively safeguard all those who are in our care or enter our facilities. What are the symptoms? The symptoms of H1N1 influenza in people are similar to the symptoms of regular human flu and include fever greater than 100 degrees Fahrenheit or 37.8 degrees Celsius, sore throat, cough, stuffy nose, chills, headache and body aches, fatigue, and some people have reported diarrhea and vomiting. Similar to seasonal flu, H1N1 in humans can vary from mild to severe. H1N1 is spread through contact with an infected person or a contaminated surface. How do you protect yourself? There are everyday actions that you can take to help prevent the spread of germs that cause respiratory illnesses like influenza. Take these steps to protect your health. Cover your nose and mouth with a tissue when you cough or sneeze. Throw the tissue in the trash after you use it. Wash your hands often with soap and water, especially after you cough or sneeze. Alcohol-based hand cleaners are also effective. Avoid touching your eyes, nose, or mouth. What should you do if you get sick? If you become ill with an influenza-like symptom, please call your physician, particularly if you're worried about your symptoms. At this time, testing is not recommended for mild cases. Your healthcare provider will determine whether influenza testing or treatment is needed. If you're sick, you should stay home for 7 days after the onset of illness or for at least 24 hours after the symptoms have passed, and avoid contact with other people as much as possible to keep from spreading your illness to others. Children might be contagious for longer periods, and children under the age of 5 should stay home for at least 10 days following the onset of illness. What are the signs of severe illness? If you become ill and experience any of the following warning signs, seek emergency medical care. In children, emergency warning signs include fast breathing or trouble breathing, bluish skin color, not drinking enough fluids, not waking up or not interacting, being so irritable that the child does not want to be held, fever with a rash, or flu-like symptoms that improve but then return with a fever and worse cough. In adults, emergency warning signs include difficulty breathing or shortness of breath, pain or pressure in the chest or abdomen, sudden dizziness, confusion, and severe or persistent vomiting. Also, if you have mild flu-like symptoms and any of the following conditions, seek medical care. High-risk conditions include chronic lung, heart, kidney, liver, or blood disorders, immunosuppression, including HIV infection, compromised respiratory function, long-term aspirin therapy, pregnancy, being over the age of 65 or under the age of 5. What medicines can be used to treat the virus? Antiviral medications are important for treatment in patients who have severe influenza, which requires hospitalization, or in those at increased risk for severe illness. These medications are given within the first 48 hours of symptoms. They may also be used to prevent the flu in high-risk individuals. At Resurrection Healthcare, we have been dedicated to improving the health and well-being of the communities we serve for over 100 years. We are proud to serve as a resource to help and reassure you of our commitment to you and your family for the highest quality health care, especially when you need us most. To learn more about the H1N1 Influenza A virus and what we're doing to protect the health of the community, visit us at reshealth.org.